a challenging life, and many a times we cannot cope up with a fast-paced life, which leads to physical, mental and emotional disorders, which shatter us completely. In the modern world, mental health disorders have become a leading cause of disability globally, exacerbating human health. With the divine blessings of Lord Dhanvantriji, hope lies in Ayurveda. Dr. Navdeep Sharma, a spiritual healer from the city of the Golden Temple. His graduation from Sri Lakshmi Narayan Ayurvedic College, one of the oldest institute in our country, associate with Sri Durgyana Education Foundation. His masters from the University of Madras. His PhD in the role of Ayurvedic herbs in psychological disorders. Listed in the World Book of Records for promoting Ayurveda and developing a chain of Ayurvedic treatment and Panch Karma centers in various parts of the globe.
डॉक्टर नवदीप शर्मा को दुनिया भर में आयुर्वेद का जागरूकता फैलाने के लिए सम्मानित किया गया। लंदन में इंडो यूके लीडरशिप समिट में द वर्ल्ड बुक ऑफ रिकॉर्ड्स ने दिया उत्कृष्ट पुरस्कार।
लंदन में इंडो यूके लीडरशिप समिट का आयोजन, आयुर्वेद को लेकर जागरूकता पर जोर, द वर्ल्ड बुक ऑफ रिकॉर्ड्स ने लोगों को किया सम्मानित।
Commendable Global Recognition Award was received by Dr. Navdeep Sharma and Dr. Monica Sharma on behalf of ND Care Nirogam Private Limited for leading Ayurvedic services at the British Parliament, UK.
ब्रिटेन में बसा भारत का डंका, नवदीप शर्मा और डॉक्टर मोनिका शर्मा को मिला आउटस्टैंडिंग कंट्रीब्यूशन टू आयुर्वेदिक हेल्थ सर्विस पुरस्कार।
Dr. Navdeep Sharma has also been awarded.
A very good evening to all of you in this live interactive session of ours where we generally try to discuss quality Ayurveda with you. And while we discuss Ayurveda with you, a very prime motive of ours remains to take your questions, to discuss your problems with you. Whether you are an ongoing patient who is taking a treatment from us and want to discuss some new case with us or some medical concerns with us, or you want to share your success stories with us, or you are a new patient who is joining us for the very first time. In both those cases, we generally prefer taking the maximum of your questions. So the first question which we can see over here is, so my son 15 years old started speaking at age of 4, but speech not developed, not clear. He speaks and repeats a set of lines only, whole day, most irrelevant to situations. Many therapies are already taken, but his repeating sentences becoming more and more worse. He can't stop repeating even for a minute. He doesn't not repeat our words like echolalia, but his own sentences hold low intelligence level and not self-sufficient, even not in his daily self needs like brushing, bathing, cleaning, dressing, toileting, eating. Age is 15 years. So the most important thing which otherwise I generally suggest in this case is that if you have gone for MRI or a PET scan or a CT scan for your child since the age is 15 years and Samrid is having this problem since long, please share it with us, because it becomes important for us to know whether this is due to some underlying brain problem, genetic problem or psychological problem. So depending upon the reason why Samrit is having this problem and why this is happening to him, it becomes then easier for us on how to proceed ahead with this case. But don't worry, whatever is possible in Ayurveda, and generally a lot is possible in Ayurveda and psychotherapy for such children, but I would like to have details before I can provide you the right kind of solution to the problem. Christina Anthony. And hello sir, Zara has started saying mama in context. She is getting more aware and sitting tolerance drastically increased. We are truly amused being parents. There is no gap in herbs and therapies. Sir, please guide us how sound helps in autism. See, sound therapy, otherwise when we talk about any autistic kid, sound, even if you are listening to a music, if you are listening to a normal music, a music changes your mood. A music can increase your concentration. A music can feel you brave. A music can induce dancing in you. The different kind of musics would play a different kind of role on your mind. In autism, since in majority of the cases it is a disease of the mind, So a music therapist who is well trained towards utilizing the music in the best possible way really gives a lot of benefit to the patient. Suman Gupta ji, Divya is the coordinator. सुमन गुप्ता सर, आपके यहाँ ट्रीटमेंट अभी स्टार्ट किया है सर, ब्रेन की एमआरआई करवाई है, पीवीएल है, बहुत कम समझता है, 7 इयर्स का हो गया है पर 2 साल जैसा है। देखिए दुख की बात है कि पीवीएल आया है, लेकिन अब आया है तो हमें उसके लिए सोल्यूशन कुछ करने पड़ेंगे। पीवीएल में क्या है जी, पेरीवेंट्रिकुलर ल्यूकोमेलेशिया होता है, जहाँ पर बचपन में लेट कराए के कारण या किसी भी अन्य रीजन के कारण द white matter of the brain, which we say, is less than what is required. So yes, that MRI requires immediate intervention on the part of Ayurveda. Please let me know if some Panchakarma therapies are going on in this case, or did you visit over there with us and get some Panchakarma done? If not, I would advise you to take training at least as quickly as possible of Shirobasti, and that needs to be started immediately along with the rest of the treatment. Going ahead, PS Surgical ji. My daughter is 4 years and I am doing her therapy from last 2 years, but there is not any improvement. Attention, weak speech, not a single word, eye contact, issue not involved with children, hyper unwanted crying, and the name is Priyanshi. You are from Kolkata. 4 years is the age, and Prem Kumar Singh is the name of father. So sir, I would like you to share some videos of Priyanshi with us, just like you. There are so many parents who approach us. They have been taking those psychotherapies and everything. And yes, in most of the cases where they don't work, when the parents approach us and when we start a combination of Ayurveda and psychotherapy, that really works. Because when we are talking about autism, when we are talking about a child being autistic, we need a multimodal approach to ensure that the child comes out of autism. And that's why when the herbs they ensure that the child is there at a situation where the mind is receptible, where the mind is able to follow the guidelines, the techniques which are to be followed during ABA. So that's why in case of patients where the patients have not been getting improvement from the contemporary, the common, the ongoing psychotherapies, they show a very good improvement when it comes to treating them with the kind of treatment which we provide, where we combine Ayurveda and psychotherapy. The next question is from Tahira Kikaji. 8 years girl, autism है, सेल्फ लाफ बहुत है, क्या करूं? फिंगर्स में नेल के पास की स्किन निकालती है, क्या करूं? देखिए सबसे पहले तो हमें हाइपर एक्टिविटी को रिड्यूस करना पड़ेगा, और कुछ वीडियोस जैसा कि मैंने अभी भी बताया एक पेशेंट को बहुत ज़रूरी चाहिए, क्योंकि अगर वीडियोस हमारे पास आते हैं, उन वीडियोस को हम एनालाइज कर पाते हैं। आप चाहें इफ इट्स पॉसिबल फॉर यू, क्योंकि एज ऑलरेडी 8 years हो गई है, यू कैन ऑल्सो ट्रेवल to one of our centers and get her checked through our psychotherapist to be able to judge what exactly is the level and where exactly the work needs to be done. So going ahead with the next question. Attention is weak, unwanted. This is for Priyanshi, which I just mentioned. A sincere request to all our coordinators, please do not tag the question which has already been answered. That should not be tagged. John Vigji, good day doctor, this side John. We have started giving Brenoa to Jaden and he's getting more calm day by day. Looking forward to meet you in Chiswick for more clarity. My pleasure. I am as eager as you to be meeting you over there. Dr. Divakar Shukla is already working really hard to make it even beneficial for all of you over there, and I'll be joining him very shortly. And all the best till then. And then Varun God. Is ASD cured completely in Ayurveda? My son is 14 years old and is detected with mild ASD symptoms. Can it be cured? Varunji, I would like to have some more precise and detailed information from your end when we talk about ASD. Now at 14 years of age, otherwise mild ASD, it's not at all a problem. But when we talk about an age of 14 years, now it needs to be seen what are the symptoms he is currently suffering from. So it becomes very important that that 14 years, whether the child is having some words or he is not using speech, he is using gestures, that needs to be known. Again, what is very important for us to know is that the cognition, the IQ level, what exactly is that? So Varunji, if you can share some details on the number, the helpline number, which is there on your screen, we will be guiding you in a far better way, because then we will be able to analyze the case in a proper way. Anjali Mendeleji, my baby is 14 years old, months or not sitting by himself and has a poor eye contact, responds to name, and you are from Indore, so you are near to Mahakal's place. Indore is one of the cleanest city, rather in fact the cleanest city for India. And when we talk about a child who is 14 months in age, generally at this age the parents, they miss out towards going for a treatment. They will keep on waiting. People will tell them the child is too young. Why do we need to give the child a treatment? But what is important for us to understand is the younger the age, the lesser the duration for the treatment and the lesser the number of herbs which are required to be given to the child. So at the age of 14 years, it should not be a problem. And share some videos. Your coordinator is Teenam. She can get back to our technical panel and guide you. The best otherwise simple supplement which I guide for children of 14 months old is Breno A syrup. Breno A syrup is the syrup of choice for him, and that is something which we can start in her case, and it will definitely give you a very good improvement in her case. Going ahead, आनंद जायसवाल जी, सर लिवेंडर ऑयल जो कि बच्चों को खाने कहाँ पर मालिश करने तो ज़्यादा फायदा होगा? लिवेंडर ऑयल जनरली हम लोगों को जो ब्रह्मरंध्र होता है, सर का ये वाला हिस्सा, ब्रह्मरंध्र के ऊपर अगर लिवेंडर ऑयल की मालिश की जाती है तो बहुत लाभ करता है। तो कोशिश कीजिए ब्रह्मरंध्र का आप एप्लीकेशन लिवेंडर ऑयल की रेगुलरिटी के साथ करें। Life Hacks by Varsha is the ID. My daughter is 6 years old. We are taking Indicare medicine since 4 months. We are giving her 3 ml Babuna drops every day, but her constipation is not cured fully. Can we increase the dose? Yes, you can. See, when we talk about Babuna, it is not just any other constipation medication. It is not having purgatives which are habit forming. It's a very mild kind of a digestive tonic which gradually works towards increasing the enzymes and improving the peristaltic movement in case of a child, so that without any habit forming, without any dependence, the constipation goes away. There is no harm in increasing the dosage of Babuna. Yes, you can go for it. महक वर्मा जी, सर मेरा बेटा 5 ईयर का है, स्पीच बहुत कम है, क्या वो ठीक हो सकता है? महक जी बिल्कुल ठीक हो सकता है जी। देखिए 5 साल की एज एक ऐसी एज है जिस एज के ऊपर अगर हम आयुर्वेद और साइकोथेरेपी जिस प्रकार से हम इस्तेमाल करवाते हैं उस तरह से इस्तेमाल करेंगे, लाभ जरूर मिलेगा। बाकी 5 साल का है, रिफ्लेक्स लैंग्वेज डेवलपमेंट एज जो कि 4.5 साल तक थी, अनलकीली वो निकल गई है, इसलिए थोड़ा सा अधिक समय लगेगा, लेकिन थोड़ा सा एफर्ट्स आप डालें, विश्वास रखें तो बेटा जो है वो स्पीच में बिल्कुल ठीक हो सकता है। जकिया जी, हेलो, अली इज 4 years old, 1 month से ट्रीटमेंट चल रहा है, ब्रेनोवार सिरप दिन में 2 टाइम दे रहे हैं, 3 दिन से हाइपर एक्टिविटी इंक्रीज हुई है। जकिया जी आप प्लीज याद रखें, टेम्परेरली देखिए हम लोग अगर अपनी बात भी करते हैं, हम लोगों के भी मूड स्विंग्स होते हैं, कभी हम पॉजिटिव माइंड फ्रेम में होते हैं, कभी हम नेगेटिव माइंड फ्रेम में होते हैं, कई प्रकार के मूड स्विंग्स हैं जो हमारे हो जाया करते हैं। सो अगर किसी भी कारण से 2 दिन, 4 दिन, 5 दिन, 6 दिन तक हमें ऐसा लगता है कि जो बच्चा है वो थोड़ा हाइपर एक्टिव है, चिंता नहीं लगानी। अगर ये कैरी ऑन रहता है लगातार, देन डेफिनेटली हम मेडिसिन की डोज को और कुछ साइकोथेरेपिक टेक्निक्स को चेंज करेंगे, बट अभी इनिशियली हमें ऐसा कुछ करने की ज़रूरत नहीं है। एकता सिंह जी आपने बताया है, अध्ययन सिंह नाम है, Adyan Singh, treatment undergoing your center for the last 1 year. Since then, we have taken 3/4 doses of for Adyan, but we are encountering an increase. Uh, the complete question is not there. Ekta ji, if you can go ahead with the rest of the question, I can then guide you. Increased, no, there is nothing after written after increased. So please write down the complete details and I'll be updating you. Please provide the details to me, Ekta ji, in case of Adyant. So as we generally discuss with you in case of autism, when we are talking about autism, when we are talking about ADHD, there are a number of herbs. And when we talk about the herbs which we really give to control hyperactivity, they are used in brain OR. So the R group of herbs you will be just watching on your screens. Now these are the herbs which you see. Ashwagandha is one of them, and Jatamansi is one of them, Tagar can be one of them. So there are multiple herbs which otherwise may not be directly acting on the intellect, because there are some herbs like Brahmi which directly act on the IQ levels. They are used in Breno A. They are called the A group of herbs by us. Now, when we talk about A group of herbs, they are different from the R group of herbs, and that is what we have done in a very nice way, that we have categorized both those herbs separately so that the herbs can be used for the child as per the need. Unluckily, in majority of the medications which are otherwise available, both the group of herbs are blended together. As a result of that, a child is neither going to get the benefit of A group of herbs nor the R group of herbs. But when we are doing it, the best part is that as per the need, we firstly, with the help of psychotherapy, try to understand that what is the need of a child. And when we know the need of the child, then we use the right kind of combination where brain A is required, where we need to increase the activeness of a child, where we need to increase the language very quickly, we use A. But where we know that the language, the words are there with the child, but the child is not using those words, there we use R to ensure that the child gets more focused, more concentrated, and is giving more attention to the parents. So Ekta ji, even if he's in anxiety, hopping continuously in the room for hours, just try to check if some scenarios have changed for him. Always, in all cases, we firstly need to understand the reason why the child is getting restless. So we need to understand that also. For that, I would really appreciate if you can discuss this thing with the ABA expert who is doing the ABA for him. I hope you are not missing out on the ABA sessions which are guided to you by our team. They are very important. Please ensure that those ABA sessions are not missed by you. And later on, if despite the proper ABA sessions we feel that this is not coming down, then we will be working towards medications, because my priority is always the minimum medicines, more of guidance, so that the child comes out of the problem also and doesn't have to take too many medicines also. So for all of you who joined us today in this live session, it will be a smaller live session because with the crunch of time which I have, as I am soon moving on to UK, there are few of you, rather many of you, who are waiting for me over there and looking forward to meeting you, all of you over there. I, Dr. Navdeep Sharma, shall now be taking a break from you. Have a good day. Stay healthy. Stay wrist-poised. Namaskar.
Autism is a temporary phase in the life of a child if treated timely.
Patient name Parth, age 3 years, disease autism. Chief complaints: speech delay, hyperactivity, irritative behavior, less interaction, less understanding. The parents of the child consulted Dr. Navdeep Sharma on April 2023 at 1:09 p.m. and felt the scope of treatment to work for the child. He did not respond clearly and showed irritative behavior most of the times.
करो
आ जाएगा वो.
कलर करो. वेरी गुड पार्थ. कलर करो. नो, इस हैंड से कर. वेरी गुड. इसके अंदर रख दो. वेरी गुड. पापा का हैंड, दीदी का हैंड पकड़ो. हैंड. चलो. वेरी गुड. खाओ. वेरी गुड. हेलो पेरेंट्स. पार्थ हेलो करो. हेलो करो. ये पार्थ है, मेरा बेटा, 4 साल का होने वाला है. लास्ट ईयर जुलाई में हम डॉक्टर नवदीप शर्मा सर के यहाँ पहुँचे थे. हमें एक सर ने मेरे बताया था सर के बारे में. हमने सोचा भी नहीं था कि आज 9 महीने में पार्थ मम्मा पापा हमसे बोलेगा इतनी जल्दी। हम तो मतलब बड़ा एक माँ पेरेंट्स के लिए एक रहता है कि कब हम मम्मा पापा सुनेंगे पार्थ के मुंह से। आज पार्थ मम्मा पापा और विद सेंस सब कुछ बोलता है भगवान की कृपा से और सर की मेडिसिन और सर के गाइडेंस से। आज 9 महीने में पार्थ एक नियर टू नॉर्मल लाइफ जी रहा है। और स्कूल में भी पार्थ प्ले ग्रुप में था। अभी जस्ट 15 दिन पहले ही स्कूल में मैम ने बोला कि पार्थ को हम नर्सरी में भेजेंगे। और जो सर ने जो लाइफ में हमारी खुशियाँ दी हैं, बहुत एक पेरेंट्स के लिए इससे ज़्यादा और क्या हो सकता है कि उसका बच्चा इतनी जल्दी और इतना अच्छा इम्प्रूवमेंट हो जाए, एक पेरेंट्स के लिए बहुत बड़ी बात है। थैंक यू सर, थैंक यू वेरी मच हमारी लाइफ में इतनी बड़ी खुशियाँ देने के लिए। थैंक यू एंडी निरोगम।
Autism is a temporary phase in the life of a child. Please treat it timely.
Patient name Vivan, age 4.5 years old, disease autism. Chief complaints: speech delay, less understanding ability, inexpressive, sensory issues, lack of focus. The parents of the child consulted Dr. Navdeep Sharma on 27th November 2022 at 11 a.m. and felt the scope of treatment to work for the child. The chief complaints were speech delay, unable to write, and sensory issues. The child could not write by himself. He was also not very socially active. Throughout the treatment, significant improvement was seen in the child. He started writing on his own, gave answers and also became active. He started interacting more and gave answers instantly. His focus also saw an improvement. He also participated voluntarily in activities and also excelled academically. Instant responses were also seen within a few months of treatment. With improved attention span, he became quick in recognizing and mind games as well. He was able to interact more with peers, participate in class and also understand things in a better way.
हाय, मेरा नाम प्रिया है एंड मेरा बेटा है 5 साल का होने वाला है एंड मुझे नवदीप सर से मेडिसिन लेते हुए मोर देन 1 ईयर हो गया है एंड आई हैव चेंज लाइक आई हैव सीन इमेंस चेंज इन माय सन। लाइक जब हम यहाँ पे आए थे तो ही वॉज लाइक वो एक एक वर्ड ही बोलता था एंड जब से हमने मेडिसिन शुरू की है एंड मेडिसिन के साथ साथ शिरोधारा भी इसकी मोर देन 1 ईयर से चल रही है एंड विद कंटिन्यूटी ऑफ दिस मेडिसिन एंड ऑल उसमें ड्रास्टिक चेंज है। जैसे अभी वो सब कुछ अपनी चीज़ें 99% अपनी चीज़ें वो बता पाता है ईजिली एंड दैट टू ही स्टार्टेड मेकिंग फुल सेंटेंसेज ऑल्सो। क्लास में भी अकेडमिकली ही इज़ गोइंग सुपरबली ऑसम। ही हैज स्कोर्ड 88% इन हिज लास्ट टर्म एंड जहाँ पे जब वो नर्सरी में था ही जस्ट स्कोर्ड 55%, नॉट इवन 50%। एंड अभी जस्ट टर्म ए में ही इज़ इन जूनियर केजी, अभी टर्म ए में उसके 88% नंबर आए हैं। नाउ ही हैज स्टार्टेड राइटिंग ऑल्सो। पहले वो मतलब पकड़ के लिखता था, पेंसिल पकड़ के, उसका ग्रिप भी प्रॉपर नहीं था बट अब वो लिखने भी लग गया है। प्लस मुझे जो मेडिसिन से जो मुझे मेन फ़र्क दिखा है दैट इज़ सेंस। जो मुझे चाहिए था कि सेंस में थोड़ी सी डेवलपमेंट, पहले उसको फ़र्क ही नहीं पड़ता था कि कोई घर में आ रहा है जा रहा है, वो जस्ट कमांड वाइज ही चल रहा था। लाइक ही स्टार्टेड फॉलोइंग माई कमांड्स, लेकिन अपने दिमाग से वो कुछ नहीं कर रहा था। बट जब से मेडिसिन लेना शुरू किया आफ्टर 3 मंथ्स मुझे ज़्यादा चेंजेस दिखे हैं। 3 मंथ्स में धीरे धीरे चेंज आए। अब विद इन अ ईयर तो ड्रास्टिक चेंज है। जैसे उसको देख के आप बोल ही नहीं सकते हो कि दैट ही हैड माइल्ड ऑटिज्म, तो उसको माइल्ड ऑटिज्म ही था बट अब वो माइल्ड ऑटिज्म के स्पेक्ट्रम से भी निकल गए। अब जस्ट उसके थोड़े सिम्टम्स रह गए हैं एंड वी आर स्टिल इन टच विद नवदीप सर। वी आर स्टिल टेकिंग द मेडिसिन। उनकी जो भी गाइडलाइंस है, बीट डाइट, बीट उनका यंत्र, वी आर डूइंग दैट रिलीजियसली एंड आई मीन इट। विद दैट हम उनको हीलिंग म्यूजिक भी सिखाते हैं जिससे बच्चा इंटरनली भी हील होता है। मेडिसिन हम दे रहे हैं, सो आई एम क्वाइट हैप्पी विद दी मेडिसिन एंड फैसिलिटीज। द डॉक्टर्स आर एवरी टाइम अवेलेबल और मुझे हफ्ते में 1 साल से ज़्यादा हो गया, मुझे हफ्ते में 1 कॉल ज़रूर आता है यहाँ से दैट यू नो वेदर द थिंग्स आर गोइंग राइट। विवान के बारे में दे आस्क कि वो कैसा चल रहा है, तो लाइक दे आर इन टच। द होल टीम इज इन टच विद मी मोर देन 1 ईयर। मेडिसिन यहाँ पे टाइम से आ रही है, हमें घर पे डिलीवरी मिल जाती है। जब हमें आना होता है नवदीप सर के, हमें कॉल्स आ जाते हैं दैट यू नो वो अवेलेबल है।